Hi, everyone. Welcome to our webinar. Sorry we got started a couple minutes late. This is about supporting individuals who are LGBTQIA+. And we have Amy Darpino here. We're really looking forward to hearing her speak about this topic. So we're just going to take a moment to let people in, and then we'll get started in just probably less than a minute, but we want to get people in as soon as quickly as possible. It's a popular topic. We had a lot of people register, so we're excited to hear about it. Yeah, it's slowing down now. So we'll get started. More people may come in the next few minutes, but just want to welcome everyone. I'm Julie McKinney. I'm the moderator for the health literacy community for the Health Literacy Solutions Center, and I'll be moderating today. And I want to welcome Amy Darpino, and I will give you a real introduction in just a minute. But as you know, that just the quick housekeeping slides. You'll all be muted during the webinar. If you want to ask questions, please use the Q&A box, and Amy will take those at the end. Also, please feel free to use the chat box for comments and other things you want to share. Just make sure to put it on to everyone instead of hosts and panelists. If you have any technical difficulties, you can email the support@healthliteracysolutions.org, and this will be recorded and put on our website on the Solutions Center, so not to worry. The slides and the recording will be available to you all. Let's see, I think that is about it. Oh yeah, one more thing for SEO. If you want CEO credits, you'll get an evaluation after the webinar, and once you fill that in and submit it, you will get an email with your credits. So keep an eye out for that. And I guess, and I think that's all the housekeeping we have to do. I'll put that information in the chat too in a moment, so not to worry. But now I want to introduce Amy Darpino. Amy is a health equity specialist at Arizona Complete Health, and she's worked in the social work and healthcare fields for over 25 years. She participates on local and statewide focus committees that have priorities to eliminate health disparities for underserved populations. Amy's a parent of a transgender daughter and is an alumni member of the Human Rights Campaign's inaugural Parents for Transgender Equality Council, a coalition of the nation's leading parent advocates working for equality and fairness for transgender people. Amy's presented workshops at many local and national conferences and is a strong advocate for change and anyone in need. So Amy, welcome. Thank you for speaking with us today. And I will turn it over to you.
Thank you so much. I really appreciate this opportunity. And with all that being said, I just want to add in all the different roles that I've had within my work. And personally, I still hear so many stories of people who are struggling because they're not being treated with respect and dignity, or they're being discriminated against. And so I'm really thankful to have this opportunity to talk about how we can be more supportive. We're going to kick it off with a short video that's going to tie in kind of everything we're talking about today.
To treat me, you have to know who I am. I identify as a Latina lesbian mother.
To treat me, you have to know who I am. I identify as a transgender man.
To treat me, you have to know who I am. I identify as a gay man.
When I was about 15 years old, I remember going into the doctor's office, and I remember telling her when she asked about my sexual activity, if I use condoms or anything like that, and I said, no, I'm gay. And I just remember her face changed very much, and her warm tone of voice turned very harsh, and it seemed as though she was rushing me out as quickly as possible.
I do think the LGBT community has special needs. I think the LGBT community has a specific special need, which is to be treated the way non-LGBT people have been treated forever, which is to be asked about their sexuality, to be asked about their quality of life, what their home situation is, what their work situation is, what their friend situation is, without the person asking the questions being afraid of what the answers might be.
My partner and I and our children were on a family vacation, and my older daughter became sick. And we get to the hospital, and they asked who was my daughter's parents, and I said, well, she has two moms. And they were like, well, she can't have two moms, only one of you can go in. My daughter was traumatized by that. We were traumatized by that.
My partner was hospitalized recently. When he was being moved from intensive care to a hospital bed, the nurse in charge would not let me accompany him. I asked if I would have been allowed to accompany him if I were part of his family, and she looked the other way.
What needs to happen when a patient is admitted to a hospital is that the care providers think about the fact that the patient might have a different sexual orientation or different gender identity than the care provider.
The people who were dealing with me throughout my pregnancy, primarily my midwife and the nurses associated with them, were not responsive to my identity and didn't actually respect it.
When I was diagnosed with breast cancer, I found that my breast surgeon was unable to call me, even to give me my biopsy results. He did tell me very frankly and overtly that he had problems with my transgender status, and upon meeting me and learning of my transgender status, he decided that his first impulse was to refer me to psychiatry.
It's not about sensitivity, it's about respect, it's about humanitarian response to a human being in general.
To treat me, you have to know who I am. I identify as a lesbian.
To treat me, you have to know who I am. I identify as a genderqueer, biracial, Latino parent.
Thank you so much for sharing that. I'm going to share my screen right now. So, as we were going through that, were there any thoughts? This video was from 11 years ago, but unfortunately, a lot of their experiences are still happening today. So it's still really valid to talk about. In the chat, if you'd like to throw out anything that might have stood out to you in that video, that would be wonderful. And I will try to make sure that we touch base on the various points throughout this presentation, because we don't want them to have those experiences anymore. We want them to look forward to coming in for preventative care, or not be afraid to come in when they need to take care of themselves. We want to head things off early, not when it's too late. And hopefully some components in this training will help with that. I could talk for hours on this subject, but we have, less than an hour. So if I do go a little bit too fast, please feel free to, ask questions. And if our IHA team could, point things out if I miss it, that would be wonderful. But please feel free to ask questions, and my contact info will also be in the slides, so you can always reach out afterwards as well. So some of the comments I'm seeing are the pain that was present. Yes, lots of pain. Yes. What does who I love have to do with my cancer? And then somebody shared about new patient with PCP, and as soon as they disclosed their sexual orientation, they started talking about sexual partners and if you're being safe. And yes, in order to treat, you need to know the person. And everyone who I've talked with has, different experiences. So it can go really well for a lot of folks. Overall, with my daughter's care, she's 21 now, but came out around age 3. And so we've had quite the journey and experiences with providers and hospitals and specialists. And overall, most of them have been great. But there have been a few that haven't. And, when she was younger, especially, it wasn't good to be asked different questions or to go down different paths with her. So, um, you know, yeah, and Lauren mentions the trauma that occurs. It is trauma. Even using somebody's wrong pronouns, which we're going to talk about quite a bit shortly, it can cause trauma. And a lot of people don't think pronouns are a big deal, but they are. They're very powerful. So as we dive in, and thank you so much for sharing your thoughts. But as we dive in, we're really hoping that you'll learn about including culture and care. And, gender identity and sexual orientation are cultural groups, cultural components. So we want to have some awareness about some potential experiences and hopefully give you some tools to be supportive. And then we're going to have our gift exchange towards the end. Here's a question for you. If you could also please put in the chat your level of experience in supporting individuals who identify as LGBTQIA+. If you could put in the chat, if you have extensive experience, if you have somewhat, not much, or none, that would be great. There might be some stuff in here you're already quite familiar with, but I don't want to assume that everybody has that level. So I do kind of touch base on a few components to lay the groundwork as we go through. Somewhat, not very much. Perfect. Wonderful. And somewhat extensive. Awesome. Great. Thank you so much. So I want to start off quickly with terminology because you might have an idea of what a word means, and I might have an idea of what that word means, and they might be different. And that's going to be the case with people's experiences. And when they identify to you their sexual orientation or gender identity, we might automatically go in our mind, it means XYZ, and they've probably experienced this, but it's all individual. Everybody's experience is different. And so I want to just mention what I'm talking about as I'm going through the presentation. And I just want to point out that one great thing that folks can do when someone identifies, even if you think you know what that means, it's okay to say, well, tell me more about yourself. What does that mean to you? So you're starting that conversation, often starting that relationship on a mutual understanding. We don't want to make assumptions because those might be wrong. And the relationship is so important with engagement and people reaching positive health outcomes. And we really want to start it off well. So it's okay to ask respectfully, what does that mean to you? So, culture, I just wanted to point out, it's inclusive of so many things. I get a lot of different answers when I ask this to individuals. So this is not an all-inclusive list. A lot of people, when I ask about culture, immediately go to the arts, and music and different things, or race and ethnicity. But it also includes all of these different components. So age, languages we speak, our socioeconomic status, and of course, gender identity and sexual orientation. And then when I talk about cultural sensitivity, this is just really being able to learn about other people, their experiences, especially folks who are different from you, and even folks who you think you have a lot of common with, they have different identities, different experiences. So it's just being able to have that understanding and respond with respect and empathy to all diverse individuals. And I want to point out, we don't have to understand somebody's experience, somebody's life, somebody's choices to be able to be respectful and to be able to offer help. And to be culturally sensitive or culturally responsive, or a term used now a lot is cultural humility. to be able to open ourselves and realize we don't know everything about everybody or every culture, and to be able to foster that understanding actually begins with being aware of our own biases. Everybody has them. Be aware of our assumptions and challenge them. Learn about whatever your bias may be, and challenge those assumptions and grow, talk to people, do research. And when I talk about using appropriate language, it's more like inclusive and sensitive language. So again, those terms change all the time. And what we think is okay and sensitive today might not be tomorrow. So just that willingness to kind of go with the flow and be open to that learning, especially as youth are identifying. I'm hearing more and more terms that I never heard of, because they're searching and they're finding things that actually describe how they feel on the inside. And so there might be, different things out there that you're just not familiar with. And so being inclusive and sensitive as much as possible is wonderful. And I just want to point out, of course, all of our cultural components, it's a cultural construct. So there's different ways people react to news. People want different folks in the room. There's different words and such that we use that other cultures may not use to describe symptoms or to describe diseases. And there's so much research out there that shows including culture and care actually improves outcomes, and it actually leads to health equity. And a key component is the cultural and linguistic competencies of providers and educators. So that's really powerful in helping somebody achieve health equity. If you're not familiar with health equity, which is being a huge focus now federally as well as in many different states, it's that optimal health that somebody can achieve. And so many things impact it, but most noticeably are social determinants of health and the historic and current discrimination that exist, which you heard some of in that video, and then the lack of culturally responsive services out there. So as we go through this training, these are different terms here that I'm going to be referencing. If I'm talking about a lesbian, it's somebody who is attracted to or romantically involved. They identify as a woman and they are attracted to those who identify as women. Gay, historically, it's been used interchangeably, but in the past, most referred to it as someone who identified as a man who was involved with a man. But I know a lot of people who are not men who use that term because they don't like other terms for themselves. Bisexual is somebody who's attracted to folks who identify as men and women. Two-spirit, a lot of tribes, not all, may use two-spirit to describe themselves for having both masculine and feminine energies. Non-binary, if somebody says non-binary, which is happening more and more with youth, then that typically means they're not following that societal concept where you have to be man or woman or gay or straight. They're somewhere on the spectrum, somewhere in between or outside of it. So it's just telling you they don't identify as man or woman or gay or straight. Intersex, this is actually a physical condition that there's over 150 conditions. Somebody has male and female sex characteristics or hormones, DNA, chromosomes, etc. And it's happening more and more. I believe the last statistic I heard was about 1 in 1,000 births or individuals who are intersex. And often in the past, historically, doctors would pick a gender identity for them. There would be surgery involved to make their body parts look a certain way, and that would happen when they were babies. And so there's so many stories of folks who were growing up who didn't know that happened. They don't identify with the the identity they were assigned, and lots of challenges have ensued from that. Gender fluid as somebody who might say that they feel more feminine today. And again, these are kind of stereotypically masculine, feminine terms that I am talking about, but they might feel more feminine today, more maybe non-binary tomorrow, and more masculine another day. So it just kind of flows. Questioning, of course, is somebody who's questioning me. They've been told something a certain way, and depending on their circumstances, finally when they're maybe in their teens or adulthood, they're questioning and trying to explore and find themselves. Queer is a term that historically was used negatively, but it is being embraced by many to take that power back. And so if somebody says they're queer or genderqueer, I believe is in our video, that's just saying that they, again, don't identify to the man or woman or gay or straight kind of either or philosophies. And there's so much more. There's so many identities. We could probably spend all day talking about identities. And then heteronormativity, this is important to talk about. If you're not familiar with this, it's that identity, that concept that heterosexuality is the norm. And, that's throughout history for various reasons listed here. Society is moving more towards an open and inclusive environment, but historically, that was what was considered the norm. And folks who didn't align with heterosexuality or with the gender identity as well, being man, woman, then that's where the challenges come in with the discrimination, the health disparities, inequities, etc. This narrative looks like for myself, I was assigned female at birth because the doctor just looks at our genitalia and then our life is dictated. So I was assigned female at birth. I was assumed to be a girl and grow up to be feminine and identify as a woman and marry a man. And so that's kind of that narrative. So anybody who doesn't follow that, historically, there's been challenges. And that heteronormativity narrative is so many places. If you think of a toy store, when you walk in there and, what are the visual cues for what toys should go to what gender identity? You have anything up in the chat? Even the toy stores who say, oh, we're not going to say they're boys' toys or girls' toys. They take those out, but still, what do you have visually when you go? Yes, the pink and the blue. Which historically, by the way, in case you didn't know, blue used to be the feminine color and pink and reds used to be the more masculine color, but somehow things flip through time. But I often do see, somebody who looks like a little boy going towards that princess dress or the doll. And I've heard several times the parents say, those are girls' toys, stop, move on, move along. And then also, intake forms historically just have male or female on there, or married or divorced. A lot of things in media now are more, and TV shows and such are more inclusive and have authentic representation. But historically, if there was a gay character or a transgender character in a movie or TV show, it was to be made fun of, or, really highlighting the stereotypical thoughts about them. And there's so many examples out there of that narrative and assumptions based on that narrative. So again, there's millions and millions of people who don't live that narrative. And because we didn't in my family, with my daughter being transgender, there's been different challenges with that, with bullying and with different, ways we've been treated by folks. And that can really take a toll on individuals. I want to mention that there are policies and laws in place to protect, to support, to encourage highly that gender identity and sexual orientation are included in care. If you're not familiar with the national class standards, they are all about health equity. And if you receive any federal funds, if you're a health plan, if you're a provider, you need to follow the class standards. And there's resources regarding those that I will send out as well. And they're issued by the U.S. Department of Health and Human Services, and they are required to be implemented at all levels of care, and there's 15 standards. We also have the Section 1557 of the Affordable Care Act, and this one prohibits discrimination based on sex, which is inclusive of gender identity and sexual orientation. There's many laws also that address this, but the prior administration attempted to and did take out that protection for gender identity and sexual orientation. But it was never officially revoked as law. So that only meant that the Office of Civil Rights during that time wouldn't pursue any cases of discrimination that were based on gender identity or sexual orientation, but it was still law. You still have to offer the services that you would, if you offer a service for somebody who's not LGBTQIA plus, and they need it for life-saving care, medical necessity, then you're supposed to also offer those services and approve those services for those individuals. The current administration actually is putting everything back officially into the Affordable Care Act, and the memorandum should be coming back soon. So either way, this is still in place and it's still law. There are protections. So if individuals feel they're discriminated against, they can now officially again file a lawsuit with the Office of Civil Rights. It will be pursued, but they also have so many other recourses where they have won over the years outside of the Office of Civil Rights. There's different, the ACLU and Lambda Legal and things will take on cases and win. So I thank you so much for putting that link in there, the Think Cultural Health. Awesome. They actually have the class standards, they have blueprints and different things to actually give you ideas of how you can implement each of the standards in your organization. So they have some general blueprints and then they have one specific towards behavioral health. So I highly recommend that you do a deep dive into those. There's even a class assessment tool that I'm happy to send out, where you can actually kind of audit your individual organization against each standard to see how you're doing. And it's a great tool, a great way to get a snapshot, a great conversation starter with anybody you need to talk to at your organization. It includes so many things around health equity. And so I'm happy to send that out too. I want to talk a little bit about some of the challenges and some of the content coming up will be challenging and also, depressing, but there is hope. So just want to kind of give that disclaimer before we dive in. But here are some statistics. So the coming out process can be very scary to individuals. It can be challenging and you don't know how it's going to go. And it's not a come out once and you're done deal. So, my daughters had to come out in different situations. We don't know how it's going to go. Oh, sorry. Sorry, got that. We don't know how it's going to go. It could go differently each time. When you come out to one person, it could go great. The next person, maybe not so great. And so this is a lifelong journey. Coming out can lead to rejection. It can lead to rejection not only from family and friends, but healthcare providers. As you heard in that video, several individuals, once they disclosed, were treated horribly. They can lead to discrimination. There are still states, even though the federal government now protects folks in jobs, but there are still, I think, about 29 states or so where you can be fired for being LGBTQIA plus. They might make it be around you being 1 minute late to a meeting or something, but you can be fired. There's not those protections in place. Folks aren't supposed to be discriminated against in healthcare, but they are still. I'll still hear about people having challenges. And what's really sad is that if somebody has a negative experience or they hear about them and they're afraid to go in, then care is delayed. And oftentimes, I've heard too many stories, and there's a documentary out there called Southern Comfort, which outlines how that individual who identified as transgender didn't get the care they needed, and then they ended up dying from cancer. So there are a lot of situations like that. there's a national discrimination survey that's out there. There's a new one happening right now, but the 2011 survey, I believe it showed about 27% of individuals who identify as transgender won't go in for care because they're afraid to. That's a lot of people. And of course, it leads to a lot of different health disparities. Victimization. There's so many folks who are harassed and bullied and attacked because of who they are. There's too many stories out there, individuals leaving a gay club and being beat up, or transgender women, especially transgender women of color, having the highest rates of being murdered. I believe there was about 34 murders this year so far, and probably 99% of them were trans women of color. So there's a lot of discrimination as well in shelters, housing, correctional centers. There's, sorry, my nose itches. There's, folks who are forced to be housed in shelters or treatment centers or in corrections based on their physical anatomy. Recently, I heard of somebody who, even though their sex marker was changed on their documents, they were still arrested and forced to be housed in the male side of the corrections when they were a woman. So that leads to all kinds of things. I've heard of trans women who needed a substance use group, and they were going to be forced to be housed in the unit that they did not identify with, so they did not go in for treatment. How is that person now? Are they engaged in care? Did we lose them? So, there's a lot to be looked at there and to unpack, and we could talk a lot about the different health disparities. Suicide attempt rates, I believe, for folks who identify as lesbian, gay, bisexual, and queer are about 9 times higher than folks who are not identifying in those populations. But then for trans folks, like 26 times as high. There's statistics showing, about 50% of trans folks have had the suicidal ideation and thoughts. And I wanted to point out that, yes, Justin said there's some tribal nations that don't offer clear protection. Yeah, there's states that don't offer clear protection. The federal government tries, but then there's so many states that each legislative session, I don't know if folks pay attention to that at all, but I believe last legislative session there was over 300 bills across the state attacking individuals who are LGBTQIA, most of them being against trans people. And there are several states that have outlawed care for trans kids. I believe Arkansas, Tennessee, there's some here in Arizona where I am focused, where if parents seek care to and affirm their kid's identity, they can be called into child protective services. Doctors can be criminalized for prescribing hormone blockers or hormones. There's a lot of misconceptions out there about what happens with kids. They're not experimented on. The hormone blockers actually have been around for years and used with prepubescent kids who went into early puberty for so many years. And there's a lot of years of history with the blocker where it actually can stop puberty where it's at or before it starts if your kiddo comes out even younger. Buy some time, save some youth from going through that puberty. But if they're stopped for any reason, within 6 months, the body goes back on track. They're very safe. And so there's a lot of medical organizations, the American Academy of Pediatrics, American Medical Association, the different psychological organizations, all of this research and evidence showing that affirming anybody in their identity actually saves lives and improves outcomes. But these states are still coming up with different ways to discriminate. Trans girls can't play sports. My daughter played, in elementary school, it was co-ed, so it was great. It didn't matter. Junior high, they let her play on the girls' teams. High school, she had to go through a community or a committee with the state, the athletic committee, and got approval to play on the girls' teams. And, you know, she wasn't very athletic, but the exercise was great. She was with the girls, she made friends, she loved it, and she thrived. But now, and now she's out of high school, thank goodness. But now there's so many kids who can't play, and by law. So, you know, there's not an advantage given if individuals any age are on blockers. That testosterone's not going through that body, and you know, they can test, it's at 0. You know, and estrogen, if folks are getting estrogen, that actually weakens your muscles. It does change your body in so many ways. But, you know, so people just keep, you know, coming up with different ways to discriminate and not doing the research or not listening to the experts because of different reasons. So a lot of this can happen. And I just want to point out this number, the 7.1% of adults coming out, this has actually gone up. It used to be about 2%, and then I heard a 4%. Now it's 7.1 of adults identifying in this Gallup survey. But this is just folks who are comfortable identifying. There's so many individuals who are not out because they're afraid to be counted in anything because they don't know what will happen. So 7.1%. And then this breakout just shows kind of that 7.1% of adults, but actually we have, you know, the composition here of how many within each age group are identifying as LGBTQIA+. And so it's, yeah, somebody had talked about the great jump. It is, and there's more and more because there's more representation. You know, there's more kids and more adults who can actually see themselves represented in the media, in good stories on the news, in other individuals that they're connected to. And so there's more conversations and more people are feeling comfortable to be out. And I think that's going to keep growing and growing. And so we need to have things in place for everybody to have that inclusive, safe, welcoming environment in any institution. So of course, we're talking medical care, mental health care, but in schools, in colleges, in the work environment, you know, through somebody's lifetime, in facilities for older individuals. So I already kind of talked about some of this, you know, that stigma or the victimization. And again, this isn't going to happen for everybody. Not, you know, if somebody identifies as LGBTQIA+ doesn't mean all this is going to happen to them. There's so many who have had great coming out stories and great helpful, nurturing environments where a lot of this isn't going to happen. But it could, you know, then again, the next time they come out to somebody or just, you know, have to disclose for any reason, medically, we're kind of, you know, forced to out them, you know, our kids or people are forced to out themselves because, you know, whatever medications they might be on, et cetera, there's no hiding. And so, so there could be a situation where somebody who has great supports faces something, but it can lead to all of these different things. And again, you know, we have the delayed care on there, isolation, the various health disparities. We could spend hours talking about the health disparities, but I really recommend you kind of Google Healthy People 2030 and 2020 have some great resources about disparities, and I believe they're in the resources that I have listed. So what can we do? What can we do? So, and yes, you're welcome. Yeah, not everybody's gonna, I can't stress that enough, because a lot of people do go to that thought that because of somebody identifying as LGBTQIA+, that means they're gonna have all of this stuff happening. They're not. Luckily, I mean, my daughter has, everybody who had been supportive except a couple medical people and her father, but everybody else was really supportive. But she still has some anxiety and has had some challenges in that regard. But there's so many people who are thriving and will never have to worry about some of these pieces. So, but what can we do? if you do have somebody that discloses to you or that you work with or in your field, one key thing is creating welcoming environments. There's statistics out there that show that just having one supportive person can reduce so many disparities, but including the mental health disparities or that suicide ideation. Just having one supportive person can reduce that ideation quite a bit. Caitlin Ryan with the Family Acceptance Project had some studies on that, and it shows, if you have high level rejection, of course, the higher the statistics for the different things she studied, moderate, it goes down, and then low rejection, of course, the different disparities go down. So creating a welcoming environment can happen in so many different ways. One, most important is just having that respect, not making assumptions. And if somebody's really anxious about coming in, from the moment that you talk to them on the phone, the moment they walk into your office, visual cues are key. Do you have a safe space sticker or something that talks about all, we respect your culture, some sort of message, or artwork or periodicals, even your intake forms. Look at your forms. Do you have expansive options on there? My daughter just started with an acupuncturist, and when we went in, their form asked about legal name, preferred name, pronouns you use, sex assigned at birth, your gender identity, and all these awesome questions that she saw herself in. So many people will go into an office setting and they don't see themselves represented in the forms or in any of the messaging or about screenings or marketing materials. So, kind of look at, I have an inclusive and sensitive document I can send out with the attachment that gives some recommendations on how to change words to be inclusive. Well woman exams, there's so many people who don't identify as women who need all of those services listed. So if we can, try to stay away from gendering services and just list, an annual preventative exam and then list pap smear, mammogram, all the different things that might be needed. Because otherwise, if we just stick to women, people are not going to see that. They probably won't feel safe or welcome to come and get the care. And again, it leads to all those different health issues. So, look at your policies. Do you have non-discrimination policies that are inclusive of gender identity and sexual orientation? Do you have a statement on your website? I've seen that on a few websites where they have a statement saying we welcome everyone, blah blah blah, and that's key. And in your hiring policies, when my daughter was looking for a job, I made sure she looked for and only applied with companies who had an explicit non-discrimination policy that offered supports for her identity and sexual orientation, because that is really important. So kind of go through your policies and just see, are you inclusive? Are you using inclusive wording? And what policies do you have in place? How are your restrooms? Do you have all gender restrooms? Do you have the statements saying folks can use the restroom that they identify with? Not assuming anything. So again, you might know what gay means, but again, it's going to might mean something different to somebody else. Not everybody's going to have these experiences, so you don't want to think, oh, they came out as gay, that this must have happened to them. No, everybody's different. Really assessing, the entire person, the whole person. We want to treat the whole person. And, not having that cookie cutter approach. So meeting folks where they are, meet me where I am. And of course, engaging them. And as you're developing, if you are going to develop policies or new programs or support groups, or we're developing centers of excellence. And so we're going to be identifying within our health plan providers who are offering great care, culturally sensitive and responsive care for LGBTQIA plus individuals. So we are developing that criteria. We're going to have a focus group coming up in February, inviting members enrolled with us to the table to talk about what they want to see in a center of excellence, how they want to be treated at a center of excellence. And we're going to use their feedback to develop that model. So that's just one example. So engage them, bring them to the table. Whether, you have staff that you're working on, do you have employee inclusion groups? If so, wonderful. Invite those groups to the table as you're developing and reviewing policies. If you don't, consider developing employee inclusion groups. Those are a great way to foster educational opportunities in learning across your organization. With our company, we have 5. We have a multicultural one. We have one for veterans and military families, one for different abilities, one that's women focused, and then one that's called Sea Pride, which is for LGBTQIA individuals and allies. And we highlight anybody can join any group, to learn more and to become an ally or an active accomplice. And it's a great way for support, and then to look at things on a company-wide level with policies, procedures, educational events, opportunities, etc. But having folks join in those planning is really key. There's that phrase, nothing about us without us, and it's really powerful. And then asking questions that, again, are respectful, but open-ended, because we want to get information. And we want to get information from everybody. Don't just ask questions of somebody who you think might be LGBTQIA+, because again, that involves assumptions based on what you might see or hear. So if you're going to have standard, have questions, have them be standardized for everybody. So we're getting to know everybody. And just a few more tidbits here. A lot of this I've already said, but the biggest one is don't make assumptions. You don't have to understand. The pronouns. So I have a whole training called The Power of Pronouns. It's also an hour long or so. And I'll have some pronoun handouts for you. But again, this is very powerful. Use the pronouns that somebody says they use. Ask. Be consistent. I use she, her pronouns. Maybe start saying your pronouns during meetings. So that kind of allows folks to know that you be a safe person to talk with. We're kind of normalizing it. People will know how to refer to you. So maybe somebody will speak up. So we'll know how to refer to them during the meeting or after the meeting follow up. If you use the wrong one, don't make a big deal out of it. I hear from so many people that just makes it worse, because then, the focus is on that. You just say, oh, I'm sorry, I meant they. I have a handout that's called 10 things that, that are harmful when you ignore somebody's pronouns. And so I'll send that out. It's really a really impactful document that I think really gets many people thinking, because you might not realize that by doing it, it causes harm. You're not validating somebody, you're not seeing them, you're not listening. You think you know them better than they know themselves. You're diminishing them, or maybe putting shame on them that they shouldn't be feeling. So there's so many different things tied with that. So use some of these pronouns, and please don't say preferred pronouns, because that indicates it's a choice, when really our pronouns are our identity. So pronouns that we use. So if you ask for pronouns on documents or in meetings, say, what pronouns do you use? That would be great. And then also referring to somebody, so, their chosen name might be different from their legal name. My daughter didn't change her legal name until she was 18. So, we had to tell people everywhere we went, please call her Rachel, or we would fill Rachel out on the forms, but her legal documents were different. And that happens for many people because there's many reasons, but it does cost money to have your documents changed. So, wherever you can put in the record, in the notes, in a prompt, when somebody calls in, if there's an alert, something that can tell you their pronouns and their name that they use would be wonderful, because so many times we make an assumption on that voice. And we might say, oh, hello, Mr. Jones, how are you today? When they're, Ms. Jones or Mix Jones or whatever their identity might be. And that might just totally start the conversation off in the wrong direction. Another example is if you send out letters to folks, stay away from Mr. or Mrs., please, and just use their, chosen name if you can, but just use their first and last name instead, because you might get it wrong and they might just throw that away because it's not them. And here's a really key one. Gender identity, sex orientation are separate pieces of ourselves. Sexual orientation is about who we like, who we're attracted to, and our gender identity is who we are. And it's all about our core sense of self. And then this is a great one. Before you ask anybody a question, would it be one that you would answer? Like so many people would start talking about, you know, my daughter's, you know, she's going to have surgery and affirming surgery and different things, or they would ask about, you know, there's really inappropriate questions of many of our friends, and it's like it's my daughter's genitalia is none of your business, but you know, how about your kid? You know, like, is it something that you want to be put the spot on asking about and answering those questions? A lot of times, I think somebody had mentioned in the video that, you know, they'll go in for a tummy ache, but then the questions, or I think you put in the chat, the questions come all about, you know, the body parts or who somebody is sleeping with or having sex with, versus, you know, I'm here just here for a tummy ache, or I'm just here for an x-ray. Like, it has nothing to do with my care. Can we just please? So just kind of be aware of that. And don't out people without their permission. That's happened, especially with youth at child and family team meetings. I've heard time and time again, they're outed and then they deny it and they kind of go back in the closet because they don't feel safe, depending on who's at the table. So don't do it. And just remember that the only time somebody might really feel safe is with you. And so allowing that time for them to be authentic is important. And I can't stress enough that it only takes that one accepting person to make a difference. And, you know, if you know if folks are being mistreated, you can file a grievance on their behalf or encourage them to. Any health plan has a grievance procedure or policy. Provider offices should. So I encourage that those grievances get filed, because otherwise, if, you know, as a health plan, I want to know, and I get the culturally related grievances to review. And so I will reach out to that provider organization with some education, some technical assistance. But if we start seeing more and more coming through for that one provider, then that's when we really need to look at, you know, contracting with them, because if our patients are getting harmed, why do we want to keep using that provider? So please file grievances and complaints. All right, we have a few minutes left, and I know I'm running out of time. But my remaining slides are a bunch of resources that you'll be getting. So I have a bunch of ideas for resources, but how about you? We wanted to, you know, set this up as a gift exchange. So locally, wherever you are, or nationally, what supports do you know of? What resources, what publications, what books, etc. do you have out there that everybody here could benefit from, that we could share? You know, if you could put it in the chat, we'll capture it all. We'll make sure it gets sent out in your follow-up email with all the other supporting documents. But please put some chat. And Alexis, I see your message. I'm happy to reach out to me. My email will be in the PowerPoint and we'll have it up shortly. But let's put some resources in the chat. Anybody got some? Or questions? I can answer questions while you all are putting resources in the chat. And I know it's a lot and I talk fast, and there's so much more we could talk about. Oh, good, they're all coming in. Wonderful. Cleveland resources. Amarillo Counseling, South Carolina. Youth Pride. Many states have prides. Those are great way to connect with individuals if you have a table at your local pride event or participate in their parades, kind of have that visibility. That's really key. Yeah, summer camps. Wonderful. Mazzoni Center, or Mazzoni Center, Dallas. Love it. Looks like an article or books are being shared. All right, as you're entering them in the chat, here's some publications. I have many, but here's just a few. Oops, oh my goodness, where did it go? Hold on. Sorry, I'm a little quick on the draw here. So these are different memorandums that talk about the impact of that Bostock versus Clayton. A comprehensive guide to intersex. So this, I'm actually in this book with my friend Jay. He wrote it. It goes into different cultural pieces, but as well as conditions and how to support somebody who is intersex. So that's a great book. The Human Rights Campaign. I recommend going and checking these out. You can go through the Corporate Equality Index that's geared towards being supportive towards staff who are LGBTQIA+. You can do the Health Equality Index, which is towards patients. And you can now, they have a new long-term care index for individuals who are older and aging. And those are different applications you go through. You have to meet criteria, and you can get a best places to work seal like we have that you can place on your website for patients to see, or for staff to see, or potential applicants to see, etc. So that's a great way to show support. And then these are different books. The Fenway Institute is awesome. And then here's a bunch of local and national or statewide. These are mostly statewide in Arizona, but different resources. So we have a health center that has created health homes for trans kids many years ago, and now they've expanded it to adults. We have different alliances and collectives and foundations and several youth organized. Somebody has a question: if you publish patient ed material that's more generally provided, would you remove gender for various care documents? As for reproductive health, I would just list the services. So an annual exam includes, and please get your pap smear, get your mammogram, get your prostate exam, get your, you're listing the services, you're telling them it's an annual exam. Because if you are trying to educate patients, you want to make sure we're including everybody. There's a lot of folks who are non-binary who are going to need a mammogram or the prostate exam or the pap smear. Trans men are going to need different services, etc. So
we had a question. We had a question on the discussion list a while back about pictures for pregnancy care, saying that how do you do it so it's not an obvious gender on the person on the front of the pamphlet about pregnancy care. So it's a thing.
Yeah, that's a great, and we're trying to develop some materials, outreach materials as well, specific towards LGBTQIA individuals, but maybe just like a belly or a side profile or from the back, or have a couple different, like I know several trans men recently that gave birth, or somebody who's non-binary who's pregnant. If you have those folks that are representation of that with models or whatever, just kind of have diverse pictures, or bellies. And when talking about pregnancy, I always hear pregnant woman, but just say pregnant individual, pregnant member, pregnant person, pregnancy care versus maternity care, pregnancy care, birthing parent instead of mother. Those different things and materials can really help in a great way.
I think we're gonna have to wrap up. Thank you so much, Amy. Do you have any last words, or we can just I know we're a couple minutes past. I didn't want to just cut you off, but
No, good.
Anything else?
No, that's my contact information. Please feel free to reach out. And like I said, I'll get you all the different materials that you can send to folks.
Great. No, thank you so much, Amy. Thank you all for being here. As Amy said, these slides will be available, the recording will be available, and all of the resources that Amy mentioned, the handouts, we will have all those sent to you. Yeah, so keep an eye on the webinar page at the Solutions Center, the Health Literacy Solutions Center, and all that stuff should be on there next week. And like I said, if you need credits for this, do the evaluation, submit it, and they will be emailed to you. So again, lots of great comments coming in. I know you see them, Amy, but thanks again to all the participants and to you, Amy. That was fantastic. That was really helpful and timely.
Thank you so much. Appreciate it.
Okay. Bye. Bye, everyone.
Bye.